So, and we're looking at this week's health headlines, and this week there's a lot of talk about when it comes to weight loss.
Joining us now is professor at Northwestern University Medical School and WGN Morning News medical contributor, Dr. Lauren Streicher. Good morning.
Good morning.
So this time of year, everyone's talking about weight loss, right? But the big thing is we keep hearing about this weight loss drug for diabetes is being used for weight loss. Talk about it.
Exactly. So the drug is called semaglutide. There are a number of trade names, but that's the chemical name. And this
like
drug
Ozempic
is one of them, exactly. And this drug has been around for a number of years and was FDA approved to help diabetics. But they found that it was helping people lose weight, so not very long ago the FDA actually approved it for weight loss. And the way that it works, this is an injectable drug. You inject it once a week in the thigh or the abdomen, so you have to self-inject. And basically it does two things. One is it increases insulin secretion from the pancreas, but the second is it tricks the hunger centers in the brain into making you feel like you're full. You lose your appetite, and it works. People are losing huge amounts of weight. We're talking 15 to 20% of their body weight. And I mean, let's face it, 40% of the population is obese. They are struggling. Diet books are selling like crazy. Even my podcasts on weight loss are the most people are listening to. But people are still not losing the weight because there are biologic reasons. And what this does, this drug, is it bypasses a lot of these biologic reasons that people can't lose the weight so that it works.
So what are the side effects?
People are losing weight. The side effects are really not terrible. There's some nausea, some headache, really pretty minor, a little constipation. The more serious side effects you don't see very often. There's a concern about some kidney problems, potentially pancreatic problems. But in general, the biggest issue is not the side effects, it's the cost. Let's start there.
How expensive is it?
Well, you know, I've seen ranges from $1,200 a month to almost up to $2,000 a month. And while it's sometimes...
For 4 shots, because it's every day?
Well, there's one that is every day, but
Okay.
the one we're talking about, Ozempic, is once a week. So what you're talking about is every month you're spending about $1,500 if your insurance doesn't cover it. Sometimes
and does it?
It depends. If you're diabetic, it will cover it. If it's for weight loss, it depends on your policy, or they might only cover part of it. So there's been so many people using this drug, though, that now there are shortages, so that the people whose lives really depend on it, the diabetics, they can't get it.
So what if you have to keep taking that?
Yes.
Can you take it for 2 months and say, okay, it's giving me a head start and now I'm ready to do it on my own? I mean, how is that working out for people?
Not according to the trials.
Okay.
You know, there was that influencer, what was her name?
Well, I think we have, Khloe Kardashian, people thought that maybe she used it. She says she did not.
A lot of celebrities are saying that they're not, but they are. And that's part of the problem is on social media, there's these celebrities and influencers that are out there talking about it. But this one particular one, this Remy Bader, who I never heard of her.
She said the weight came back. I had never heard of her either.
Well, so her story is, according to what's out there on social media, is that she was given the drug legitimately for medical reasons, diabetes, and so she was losing weight, and then she went off the drug. And it didn't say why she went off, but she went off, and she's been all over the place saying, well, I gained not only the weight back, but I gained even more weight. This is not a surprise. They knew this from the clinical trials.
They did.
Yes, that if you go off the drug, the weight comes back. Look, obesity is a disease. This is a lifelong problem. This is biologic. So this is something that has to be taken long term. But there's two problems with that. One is the expense. We just talked about that. But the other is there's no long-term trials.
That's what I think, as we always think about, right?
I mean, it's one thing that if a drug's been around for 3-4 years and we know that it doesn't cause problems and it works, but 15 years, 20 years, 30 years, what's that going to do to your pancreas? What's that going to do to your kidneys? So we don't really know. Now, the weight loss experts, the obesity experts, they of course stress, as they should, that you don't just take the drug, that in the clinical trials they use it in conjunction with eating healthy and exercise. And so, Larry, to your point, is it potentially a kickstart? Potentially, but for people who are really struggling with large amounts of weight that they need to take off, what we're finding is that if they go off, they are gaining the weight back.
I would imagine that people go to their regular doctor. Their doctor will give them whatever they want. If they want that. I hear that from doctors. You feel the pressure to give them what they want. But when it comes to obesity, should they be going to a particular kind of doctor?
Yes. There's actually a certification for obesity specialists who have done additional coursework, who have additional training in terms of understanding who would benefit, who wouldn't benefit, what are the things they should be using, monitoring potential side effects. And this isn't the only drug out there. There are less expensive drugs. There are other options. So in a perfect world, somebody would go to an obesity specialist who can really steer them the right way so that they don't get into trouble. But the big problem right now is the people who are taking it who shouldn't be. I mean, these celebrities, on one hand, you say, okay, if they want to spend $1,500 a month, isn't that their business? Well, but except they're causing these shortages so that the people who really need the drug can't get it.
Well, it's fascinating. You can check out Dr. Stryker on social media. Thanks so much. Good to have you here.
Thank you, Doctor.
Thank you.
Time for Around Town.
Hey, Anna.
Good morning. We're checking out a